Okay, it's 5:06. Sorry for the late start. I'm going to call the meeting to order.
Roll call, Tucker Whitman.
Come on, Tinker.
Could they have heard me? They could hear me.
They should be able to hear you, yeah.
Tucker Whitman. Andy Dennison.
Present.
Ben Vitale.
Present.
Chris Petras.
Here.
Paul Pinkney.
Here.
Keith Batman.
Here.
Hans Petcher.
Here.
Charlie Ripley.
Present.
Heidi Nightingale. Nightingale. Bailey.
Here.
Trisha Kerr.
Here.
Timothy Lattimore.
Here.
Michael Didio.
Here.
Ryan Foley.
Present.
Aileen McNabb Coleman.
Present. Before we begin our meeting today, I am sorry to share that Sheila Smith's mother, Marjorie Hamlin, passed away over the weekend. She and her family are in our thoughts and prayers during this difficult time. Stand for the pledge.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Our sincere condolences to the families and friends of Marjorie Midge Hamill, mother of Clerk of Legislature Sheila Smith. There are no public hearings. Proclamations, Provider Appreciation Day, May 8, 2020, and Senior Citizens Month in Cayuga County, May 2020. And then we have the presentation. Is Monica Salvage on?
I am.
All right, you can go ahead, Monica.
Okay, great. Good evening, everyone. Thanks for giving me the opportunity to update you on the progress of the Healing Community Study project. Can you hear me okay?
Yes.
Okay, good. I was initially set to present to you in March, but then the coronavirus pandemic hit and crisis communications channels needed to be set up, but the work of the opioid study continues. And while this ongoing public health crisis did not put the opioid epidemic on hold, if anything, it made it worse, as evidenced by a recent spike in overdoses and overdose deaths. So when life as we knew it came to an abrupt halt and the social distancing became the new norm, this meant that the support system and the routines of people with mental health and opioid use disorders were severely disrupted. And these tragic developments made this study and the work of the many community partners that we work with even more important and imminent. And these efforts need to go on, and we're determined to adjust the strategies to this new and changing environment. So I'd like to give you a little refresher on what the Healing Community Study is, because it's been a while. So it's a multi-year, multi-state research study to reduce opioid overdose deaths. We're one of 16 communities in New York State that participate in this study, and one of 67 communities in 4 states. So besides New York State, it's also Massachusetts, Kentucky, and Ohio that are participating. So it's probably the largest study of this size in that area. So our research partner for New York State is Columbia University, and the goal is to reduce opioid overdose deaths by 40% in 3 years. So how does that study work? It's a community-driven approach to address the opioid epidemic by implementing evidence-based intervention practices, with the goal to develop a sustainable model that can be replicated in other communities. So it's not that the study is studying people who are suffering from opioid use disorder. It's more looking at the systems and the decision-making practices that are in place that address the opioid crisis. And this is what's being studied. While the different communities may implement different strategies, how those strategies are being decided on and how the community comes together to work on that problem, this is what's really being studied in this project. So in essence, it's our community and us working on the study who is being, the study objects. What are evidence-based practices that we're looking at here? So those are strategies that have been proven to be successful in other areas, and they go along with opioid education and Narcan distribution. We're also looking at medication for opioid use disorder and safer opioid prescribing and dispensing practices. So how this study works is we put together a local group of a steering committee with people from all kinds of different sectors that have a point of contact with somebody with an opioid use disorder. So we have health providers, we have prevention services, treatment centers, recovery service providers, peers, law enforcement, colleges. Elaine is your representative from the legislature on it. So we really have a wide variety of folks with different expertises and different experiences on it. We also have people on it with lived experiences, which means they know what addiction feels like and what recovery can look like. And then this steering committee is supported by a local implementation team that's made up of the project director, which is myself, and then the technical assistance coordinator that we recently hired, and the data analyst. So we all work together to figure out what works best for Cayuga County, and we work with Columbia University in New York City on the bigger aspect of that study. So our goal is really to harmonize and share the local data that we have and that we need to make informed decisions on integrating the existing services or expanding them or implementing proven practices to reduce ultimately opioid overdose deaths and ensure a continuum of care so we don't have fragmented services, service providers that don't talk to each other. And I'm not saying that this is what's happening now, but we really want to harmonize the system and want to avoid that people fall through the cracks in between those services. Are there any questions on the general aspects of this study? I want to just share with you then afterwards what we're currently doing during COVID-19.
Any questions for Monica? Mr. Lattimore, then Mr. Foley?
Monica, I've been involved in a recovery program for a number of years, and I know that in my apartment complex we had a couple overdose. One led to a death. Do you know when the governor is going to allow the churches to open up a little bit so that they can hold the meetings in a church? Right now, they're doing Zoom meetings, but the one-on-one or the AA meetings are much more effective. Do we know whether or not congregations that less than 10 people meeting? Do you know whether that's under the stipulation now? Because
From what I understand. Yes, from what I understand, in churches they can congregate or they can hold services or meetings of up to 10 people. Otherwise, it looks like churches, like bigger churches that, have a bigger congregation. It looks like this is going to be in phase 4 as of now, but I can't say for sure. But so far, people are able to meet of up to 10 people, even in churches.
And I got one question for Chris. Chris, do you know where we are with the lawsuit that we have against the opioids?
I have not received an update, probably within a month. The last one I received, I sent out to the full board. I think the litigation's kind of taken a little bit of a hit, the process because of the crisis.
Right.
But should be ramping back up, and I would expect some movement here shortly. But I haven't heard anything since the last update that I gave to the board.
Madam Chair, I don't know anybody who died of COVID, but I do know our young people are dying of this addiction that's ongoing.
Absolutely. Mr. Foley, and then we'll go to Mr. Dennison.
Yeah, I just wanted to see when the results are expected. How long is the grant? I'm really interested in seeing what it, entails, what you guys end up coming up with.
I had a hard time understanding you, Mr. Foley. Could you repeat that?
When are the results finalized?
Well, the way it works is it's a 4-year study, but throughout the 4 years, we're able, so it's not just a study where something is going to be looked at and then there is a report. Throughout the 4 years, and we're in year 2 now, we're able to make implementation services. We're able to implement strategies that we think work in our community. So as time goes on, I'm going to share one with you tonight, but as time goes on, you will hear of different things that are going to be happening in our community. So it's not that you're not going to hear anything for 4 years, and then at the end, there is some report that ends up on a shelf. It's a very community-driven study, and it's very practical in the way that we're really ongoing making decisions and implementing services. Does that answer your questions?
Yeah, that's fine.
Mr. Dennison?
Yeah, I mean, it all sounds great. We always study things, especially government. We study the living hell out of everything, and usually nothing happens. We have a great organization like Nick's Ride right in our community in this county, who we had talked about giving maybe $25,000 to help them out. And, well, that never went anywhere neither. So I'm not so sure a study is what we need. It's more of action. And we could have taken some action there with a very good local organization, and we've done nothing.
Mm-hmm.
Legislator Bailey?
Can I respond to that?
Sure, yeah. And then to Elaine.
Okay. So since you're speaking of Nick's Ride, Mr. Dennison, we're working with Nick's Ride, and they're on our steering committee, and they're an integral part of what we do. And through the study, we're able to provide grant funding for certain intervention practices, and Nick's Ride is certainly one organization and one strategy that's being supported there through their peer advocacy and through their peer services that they provide. So it's like I'm trying to explain, it's not just a study that's academic in nature. It's really practical in the way that you're really going to see things that are implemented in the community.
And unless I'm mistaken, I think we did, Andy, move on that $25,000 allocation to Nick's Ride that we talked about at the time of the budget. That is a separate and aside from this whole study. I mean, as we roll out this Narcan intervention in the community. I guess the opportunity there is to measure whether or not these things that we're picking have an impact. And if they do have an impact, then we can measure that impact, and then it can be replicated in other communities. Isn't that pretty much the sense, Monica?
Yes, it is. And our process works very similar to your legislative process in a way that we call them work groups, you call them subcommittees, and they are very focused on certain aspects of, say, for instance, medication treatment or the Narcan distribution, or, how do we get enough data to really make good decisions? And so they meet throughout the month and really look at where the gaps are and what we need to do. And then they bring recommendations to the full steering committee, who meets the second Wednesday of the month. And they make the funding decisions for those services based on the recommendations. If anybody ever wants to attend one of those steering committee meetings, right now we're not meeting in person, we're meeting via Zoom. But if there's any interest, I can certainly share the link, and you can just listen in and see what's going on there and how we work.
Andy, do you have your hand up again?
Yeah, I just wanted to ask Mr. Palermo, did we do anything with Nick's ride? Because I don't think we did.
Mr. Dennis, the chair asked me the same question, so I'm just looking through the contracts drive. It appears that the contract was executed February 20th of 2020. And it says that payment shall be made 30 days from the date of voucher by Nick's Ride. Whether or not they've actually submitted a voucher, I couldn't tell you. I don't know. I'd have to get into Munis to look at that, or ask somebody who's better at Munis than I am to get in and look at that, see whether or not payment's been made. But we do have a valid contract for this year with them for the amount of $25,000.
Yes. If I may, this is Keith Batman. I'm one of the people that are reviewing and approving payments, and unless my memory fails me, we did issue a check for the $25,000.
Peter Kerr, question?
Yes, thank you for this presentation. I've been waiting for it and looking forward to it. You guys are doing really good things to keep the communication going through the crisis. As you said, this was a crisis before the COVID crisis. So one of the questions, since you were talking about your process with the first part of your presentation, I was just curious, is there ongoing communication with the other participants across the country and across the state on this, in terms of sharing best practices in real time and learning from each other in real time of how we're responding through COVID, or are we doing our work kind of separately? How is that looked at across the study?
That's a great question, because I've been asking for that since November, since I started. And most recently, the first wave of the communities in New York State, and we're 8, that started in January. We're now meeting, or virtually meeting, video conferencing every week to sort of compare notes, and sort of, we're going to be our own, learning team in a way where, we sort of compare notes and say what works and what doesn't, and how have you approached this. And, although the communities do look different because many of them are downstate, but I think, the approach, how to approach things, and especially during the pandemic now, has been very similar. But as of now, there is no contact to the other participants of the other 3 states.
Any other questions for Monica? Thank you, Monica, for your presentation and your update. We'll look forward to the next time we speak again on this. I appreciate all of your work.
Thank you.
It is not on the agenda, but I do have a short presentation, a review of what was spoken about at Ways and Means concerning the budget. I've asked Lynn Marinelli to join us today to give us a little update.
Yes, I'm just gonna go over the same spreadsheet that we had done over at Ways and Means. I think Amanda put it out available for you to look at if you want to pull it up again. Basically, what we talked about is the biggest projection is the sales tax shortfall. Use some information from NISAC that if we have a weak recession, it could be about a 9% loss, and if it's up to 21%. So I projected out the remaining months from June through December. And overall, I'm estimating maybe about a 15% reduction. So if that were to come true, we could be off about $3 million from what we had budgeted. We also have an account where we record gains and losses from our investments in the stock market, a little bit that we're able to invest in certain municipal financial instruments. We budgeted $200,000, but we could result with nothing there. We also might have some type of impact on the funds received from the state related to the negative gambling. Again, it's totally speculation on my part, just not certain how that will roll out if the gaming casinos still are very restricted in what they have in earnings. But we also have heard that state aid may be cut across the board, 10 to 20%. Our main state aid is in social services. I estimate we could lose about 1.4 million if that was 15%. So just pick something in the middle there. We haven't heard anything at this point yet, though, about any state aid being adjusted yet. One revenue that we hadn't budgeted was also from the nursing home sale, so I included that as a positive impact on the budget since it was not budgeted for. So we could be looking at 4.6 million on there, call it 4.5 million in estimated revenue losses. We do have some decreased expenditures that would help offset that somewhat. We've been notified we're going to save about $700,000 in what we pay out in our weekly shares for our Medicaid costs. That's due to some enhanced federal aid in the CARES Act that was already passed. Just not sure exactly when the timing of that will be. Again, we haven't received any specific information from your state on that. We do have the estimated savings from the furloughed employees and from the vacant positions if they continue to remain vacant throughout the rest of the year. So the expenditure savings is already at $2.5 million. There most definitely will be other savings from the health department, social services, from some programs that won't be utilized at their full level. We are receiving any bills for busing for the preschool students. We do unfortunately though have to continue paying for tuition at those facilities, even though the children are not attending in person. They are trying to do live, online the related services. A little attempting to make visits, but I'm sure it's very hard to engage children under 5 years old in those kinds of activities. So what we're going to be trying to work on the next coming weeks is trying to talk with the individual department heads to start looking at their current budgets for 2020 and get them to look through things that were maybe budgeted that still could be optional. They're nothing that involves maybe a contract that we've already engaged in. Could either be a purchase or it could be a new program. And review that, also new staffing, because if they budgeted new staff, it wouldn't show as a vacancy yet in the civil service system, which is what I use to look for vacant positions, because it wouldn't have even been created yet. So we're going to ask them to individually start reviewing their own budgets and instead of me trying to go through everybody's budget and trying to figure that out all at once. That will help us try and project. The gap right now is probably around $2 million between estimated lost revenue, estimated reduced costs. A lot of times we cover that anyhow in any given year with our savings that are unexpected during the year. So hopefully if we get everybody start looking at that, we might be able to come in where we're supposed to be if we can hold on some expenditures for the rest of the year, things that aren't planned. I guess we can talk about any capital expenditures too that maybe don't. And I think a big area we're gonna all have to kind of come together to decide about is gonna probably be the highway department, since there isn't a superintendent right now. It's unclear what we want to do with purchasing equipment, how much roads you want to do. They're large dollars amounts. The season is upon us kind of right now, so there's not a months and months to talk about it. A lot of other things are not so seasonal that other department heads might have going on, that we can see how things play out, maybe to do purchases later in the year, if the state aid, it doesn't get cut, different options like that. But I mean, that's definitely a big area that they have quite a few vacancies. They also have a lot of furloughed employees. So that's what we're gonna talk about tomorrow at the department head meeting, and then get people over the next couple of weeks. I'll send a very detailed email, giving a timeline and some direction to people. So we can kind of do that before we just start working on the budget, kind of do a mini look at it right now. Get a better feel of how 2020 we can get it to come out before we even get too far into the 2021 budget preparation.
Any questions for Lynn about this process?
Who's
Mr.
in
Lattimore?
the highway meeting tomorrow?
No, we're gonna do department head meeting tomorrow, so we're just gonna talk about this with all the departments to get them to go back and start looking at their budgets.
Who's representing the highway?
I don't know.
Me, I guess.
I mean, I help them clearly also. Kayla is their accounting person who is still there working, the junior accountant. She has a good handle on, the operation there, what they're spending, what they're not spending, contracts that they've committed to or not. So she has a good handle on that. She was here when we did the budget last year. So Mary Beth and I work with her closely with, a lot of things. When she's got questions or we're trying to figure things out.
Any other questions from Lynn? Mr. Lattimore?
In regards to our health costs, I think the president just came in with a big savings on the insulin costs, reduced. I don't know when the next consortium meeting is on the health, but hopefully our drug buy will be less than that to try to maintain that surplus that we have there.
Yeah, I mean, we've had some virtual health consortium meetings the last couple months, and our claims are actually down substantially with a lot of the elective procedures being postponed or canceled. So, we'll see. It might be a better year for us. I'm sure that our rates will still go up somewhat. Our consultant, we're a little bit low anyhow. That will be some good budget news going into next year that we won't have to absorb an increase in insurance.
You have a question?
I'm all set for now. Thank you.
It's Elaine. My only question is, if you have this department head meeting tomorrow where you sort of introduce this idea of start looking, when is it that you think the budget process will start?
We're going to talk about that as we proceed. Right now, we're looking for short-term savings and options for this year. I'm going to be having those long-range conversations with Lynn and department employees and department heads moving forward simultaneously. So it's definitely top of mind moving forward. But yeah, we haven't set a specific schedule yet for.
Okay. All right. Thanks.
Any other questions? Okay, look for hands. Okay. All right. Thank you, Lynn.
Minutes to approve?
We get a motion?
Move. Second.
Any discussion on the minutes? All in favor?
Aye.
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 Opposed? Carried, thank you.
Appointments and reappointments.
Move them as a bundle.
Any discussion on these? All in favor?
Aye.
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 Opposed? Carried, thank you.
There are no communications and announcements. I do not believe we have a report from Dr. Durant. And committee reports and individual legislators' reports.
Any specific reports by legislators? Mr. Lattimore?
Madam Chair, we're, Mr. Petrus and myself, and along with some of the electeds, Jim and Sue, and I think Charlie was at the city's flag raising or wreath presentation at our Memorial Park over here, and it was nice that Stevie Weldon and some of his color guard did march the route that we normally march in. So we're free today because of the ultimate sacrifice they gave before. So
Thank you, Mr. Lattimore. Any questions moving forward? Okay, Chairman report. So I'm going to update you on some things that have been happening here. May continue to present many challenges to Cayuga County. We've been increasing our testing capacity with testing of essential employees by appointment, as well as testing people who work in nursing homes across the county. The logistics of both continues to be a priority, not only for the safety of our residents, but also with the report of testing and results to the Regional Control Group of New York State. Today, there are 5 more positive COVID cases reported. Please continue to be mindful when you're outside of your house, to continue to wear masks, social distance, and do your best to limit the spread. Speaking of the Regional Control Group, as chair, I represent the county on this group. Each county has determined its surge capacity and increasing testing over the course of the past few weeks. In addition to the testing supplies comes the need for personal protective equipment for our public health nurses, hospitals, and nursing homes. This needs to remain a priority, and I want to thank our state elected officials for their help in securing resources for Cayuga County. Senator Helming, Senator Seward, Assemblyman Finch, and Assemblyman Magdalo continue to advocate for our needs here in this county. The Regional Control Group consists of leaders from Oswego, Madison, Cortland, Onondaga, and our county. We speak daily on monitoring the health of our communities as well as monitoring the reopening process. Currently, we are on track for phase 2 to open on or about June 1st. On or about is the operative language. These things change. I heard somebody refer to it today on our call as piecing together the airplane while we're in flight. That's a lot of what it feels like. Let's see. The dialogue and discussion has been very valuable, and I appreciate the supportive team approach and consistency as we move ahead in reopening our region. If you head to forward.newyork.gov, you will get the latest and greatest information. So that should be on your tabs. It's a great resource, and it will share what the news of the day is, as well as any new guideline changes. We're finalizing the Cayuga County Buildings Plan for COVID-19. In addition, the Health Department has been and will continue to schedule walkthroughs to determine safe working spaces within the county. These are being scheduled by Human Resources. This will accompany the plan that we create. We have a safe workspace plan, as well as for when our buildings are open to the public. Our county continues to operate at 50% capacity, and many employees are still working from home, and there are positions that have been furloughed until July 31st. A few furloughed employees have already returned due to the opening of the courts. The needs of the departments are being monitored. As needs arise, department heads make an appointment with me and HR to review the requests. In terms of staffing, we have begun utilizing our hiring committee. The hiring committee consists of the chair, majority leader, minority leader, and oversight committee chair, with human resources as our advisor. Together, we discuss any emergency requests made by department heads and with the department heads. If the decision is unanimous to hold off on a hire, it does not go to oversight committee. If a unanimous decision cannot be reached, the resolution to create and fill will go to the oversight committee. I sent you the process in an email so that you're all aware of what to expect. This has been going, we've had our second week of this so far, so we've done a few cases. The committee to review applications for our next highway superintendent will convene tomorrow. We will alert you of the process moving forward. And there is a department head meeting tomorrow at 10 a.m. As Lynn mentioned, we are meeting with departments, so we're going to be scheduling those meetings or talking about it and then scheduling tomorrow. And she'll follow up with an email after the meeting. So are there any questions of me at this time? Mr. Lattimore.
Madam Chair, I know how busy you are trying to deal with this pandemic, but I think it's a great opportunity for us to be doing our economic development issues. Tessie Plastic, which started in Weedsport, if it had a mega site in Weedsport, it probably would have stayed in Cayuga County versus Onondaga County. That's just one great success story, and hopefully with them bringing back some more manufacturing jobs at the Auburn Industrial Site is great. But we should be looking for economic opportunity. We understand that Amazon is going into Syracuse mega site. I would like to see us develop one so that as the supply chain moves back from China, that we have opportunity in upstate New York for employment. I think we're missing the boat.
Noted. Any other questions or comments? Okay, hearing none. We'll get right to Ways and Means. And we'll start with Legislator Petras.
Thank you, Madam Chair. I'm going from memory now because I can't see it, but I believe there's 4 resolutions. Ways and Means 4 was tabled, and I would offer 1 through 3. There it is. Thank you, because I can't see. So I'd offer 1 through 3 as a bundle.
This is Batman. I move the bundle.
I'll second Foley.
Any discussion on the bundle? Hearing none, all in favor?
Aye.
Aye.
Opposed? Carried, thank you.
Thank you, Madam Chair. As I previously stated, WM4 was tabled at Ways and Means. It's authorizing the Cayuga County to sell former county nursing home to Auburn Community Hospital. It is a 2/3 vote required.
I'd like to bring number 4 back. Make a motion.
Whitman will second.
If I might, WM4 was tabled at Ways, 2 ways. So in order to bring that back, it would require that the resolution be presented by a legislator to the full body in writing.
I thought the whole purpose of it was to give everyone 1 week to be able to read what they could have read in 1 minute last week. And now it's going to go to next month. That's what we're talking about?
Because nothing's been presented, yeah. I don't have any resolutions that have been offered by a legislator according to the rules.
Well, I'd like to go in the minutes as that's a crock because it was said by you, Mr. Batman, that we were just moving it to the full ledge meeting so everybody could have a chance to read that 1 minute thing they had to read last week.
we'll drag it out for a couple more years.
Mr. Peters, then Mr. Petcher.
Thank you, Madam Chair. I just had a question for council. As there's a motion in a second, how do we handle this situation?
Your rules require that any legislator can bring a resolution to the floor at any time, provided it's in writing.
No, I understand. But with regard to the motion in the second, is that null and void, or
Yeah, it would be impermissible.
unless we have it presented in writing to the full body?
Correct.
And given,
Along with the sponsor of the resolution.
just to follow up,
If we're doing these meetings, Lee, does that require me to mail it in writing?
that was my question.
I didn't catch it.
Say that again, Mr. Whitman?
If we're doing these meetings, attending these meetings in a remote fashion, do I need to mail in my motion writing?
I would think, given the circumstances, an electronic version would be permissible, but if you look at WM4, as it currently stands, as it was tabled, it's offered by Mr. Peters as chairman of the Ways and Means Committee. So introducing that on the floor under that pretense would indicate that it was passed by the Ways and Means Committee to the full legislature, which is not the case. So Mr. Peters technically can't offer it. Nobody else has provided a resolution indicating, who's bringing it forward, who's sponsoring it. Hasn't been prepared. I would think an emailed version would be sufficient, however, to constitute a writing.
Mr. Petcher?
Can we have a recess and get this straightened out right now? Is there any chance of doing that?
That would be the chair's decision.
So I move a recess for whatever we do.
I'll second Hans.
I think you can call it caucus, right?
Whatever.
Yeah.
Pause this live stream, take a 10-minute, 15-minute, whatever you think is sufficient.
The one attached to the packet, the one that there was.
The one that was tabled.
Yeah.
Correct.
Okay.
We had a first and a second on a recess, so I'm going to honor the recess.
May I
I think a point of order, if I may, this is Batman.
Yes, go ahead.
I don't think we can recess by motion of the legislature unless it's, I don't think anyway, maybe if it's unanimous vote. But my suggestion would be, if people wanted to bring this up at this meeting, why don't we do this? This is not the place to bring it up anyway. This should be under other business because it's not a committee report. Why don't we go through our agenda? In the meantime, if the people that want this voted on direct, our county attorney can bring up the resolution as presented at Ways and Means so everyone can see it, and then we can vote on it if people so choose. I would point out, though, in answer to Mr. Dennison, I wanted this, and I suggested we table this because I hadn't seen it and I had questions, and I do have questions, and I was in the process of getting my questions answered. I wasn't motioning that recess simply to take another week. I wanted to look at it to see if there were questions I had. There were, and there are, and so it's not time sensitive. I can see no harm in waiting till next week, but if you want to bring it up, I think it should come up under at the end of the meeting under other business.
That is the right thing to order, isn't it? To bring it up under at the end. A point of order. He's saying bring it up under.
It wouldn't fall under Ways and Means, certainly.
Right.
But it was not passed there, so it can't be brought up there.
Okay.
This would be a fine place to do it.
Okay. So thank you, Mr. Batman. So I will say we will bring it up again at the end of our resolutions under other business. Or whomever brings it up.
Women, between now and the end of the meeting is it just a matter of one of the legislators in attendance at the county office building handing WM4 to our attorney?
I couldn't hear.
Is it a matter of just one of these gentlemen that are placed here today handing the resolution to you and signing it or something? Is that, he's asking, is that
I
as
think
easy as that?
Mr. Dennison asked that the resolution be brought forward. If I get a chance, I can draft it. I can present 1, 2, 3, 4, 5, 6 copies here and email everybody else a PDF of that same resolution, which I think accomplishes the writing requirement.
Mr. Whitman, was that answer your question?
Yeah, I guess I don't understand why it's different now. Is it not the same resolution?
Well, it depends. I mean, it's Mr. Dennison's resolution, so, you know, I'd like to talk to him for a moment. I'm going to put his name on it, so it's clear that he sponsored it, and that it's not reflecting a Ways and Means Committee resolution, because it did not come out of that committee. So if Mr. Dennison would like to sponsor this as the legislator from District 2, certainly that's just a tiny change. And then the other changes that he may wish in that resolution, I could prepare that, and assuming he doesn't have many changes, in about 2 minutes.
New way of doing business.
Well, you got to think of the record too. I mean,
Okay.
Mr. Dennison, you have a hand up?
I was just curious why it would be under other, being it's under Ways, but that's fine, whatever. I'm texting Chris right now I'll sponsor it.
Okay, we're going to move to Health and Human Services Legislator Daily.
Yes, Health and Human Services had 6 resolutions this month. All of them have gone through the committee, both Health and Human Services and Ways and Means. I'd like to offer HH1 through HH6 up as a bundle unless anyone wants them separated.
Okay, we have
I'll move it.
motion as a bundle, second.
Are you guys sitting in here?
Oh. Can we have a second on the motion for bundle?
Okay, you'll lock it up? All righty, thank you. You too.
We have a second on the motion to bundle for HHS.
I'll second it.
Thank you, Mr. Any discussion? All in favor?
Aye.
Opposed? Carried, thank you. Okay, Legislator Foley.
Oh my God, hello.
Madam Chair.
I'm listening to it right now.
Operations.
I'm like, it's giving me a headache just listening to them.
Okay, Government Ops, we have 2 resolutions for a bundle. Can I get a motion?
Second.
Any discussion?
I can't believe they're still going through that whole private nursing home thing.
Can you make sure you're muted unless you're speaking?
Yeah.
Can we make sure that we are muted?
No. It's full. Lattimore saying you never got any of the information out.
I think it's
Take them out.
Oh, that's a fancy new one.
Yeah, that just changed. Okay, I lost it. All in favor on yes. So can we get it all in favor? And Government Ops, 1 and 2?
Aye.
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 Gary.
Opposed? Carried. Thank you. Okay, planning.
Have a good night, Lynn.
Mr. Batman.
That was a long time ago.
Yes, planning has 3 resolutions. I would offer them as a bundle.
Thank you, Mr. Batman, Chair of Planning. Can we get a motion?
Move them.
By Foley, second?
I'll second Daly.
Seeley. Okay, any discussion on these? All in favor?
Aye.
Aye.
Opposed? Carried, thank you. Okay, Public Works, Legislator Whitman. Mr. Whitman, Public Works?
Am I on now? Public Works has 4 resolutions. I would like to bundle them all while I still have enough signal to do.
I'll move them as a bundle.
Moved by Petrus, second by?
Second.
By Pickney. Any discussion on these? All in favor?
Aye.
Aye.
Opposed? Carried, thank you so much. JPS, Legislator Dennison. Mr. Dennison.
Signal up here in the north isn't so good.
Legislator Dennison. JPS. Charlie?
Patrick.
Legislator Dennison, would you like Mr. Petcher to present the resolutions?
Yes.
Madam Chair, just so you're aware, I did get a text from Mr. Dennison. His computer's froze. So,
Mr. Petcher, would you like to present the resolutions for JPS?
Okay.
Thank you.
Traditional and Public Safety has 2 resolutions. They should be bundled.
I'll move them. Second.
Okay, any discussion on the bundle resolutions? All in favor?
Aye.
Thank you, Mr. Petcher. Any other business to come before the board?
No. Motion to adjourn, Didio.
Second.
Whoa.
I thought we were working on something.
What?
I thought, what do you mean, what?
This computer is all that is.
Motion is second.
Yeah. Just call a vote.
We're never gonna experience anything like this.
Okay, so there's a motion and a second on the floor for adjournment. All in favor of that?
Aye.
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 Number opposed?
Aye.
Should we do roll call on the adjournment?
Nay.
Yeah. Let's do roll call.
What the hell?
All right, we're gonna do roll call on the adjournment. Tucker Whitman,
No.
Andy Dennison,
I assume we're still having technical difficulties.
An absence is a no anyway.
It is.
Ben Vitale,
Yes.
Chris Petrus,
Negative, Ghost Rider.
Paul Pinkney,
Yes.
Keith Batman,
Sorry, I was muted. Yes.
Hans Petcher,
No.
Charlie Ripley,
Yes.
Heidi Nightingale, Elaine Daly,
I'm going to abstain from this vote because it appears
She can't abstain to adjourn.
adjourned related to the hospital potential sale, and I'm a current Board of Trustee member, so I'll be abstaining from all related votes.
This is just to vote to adjourn, so you could either vote to say yes to adjourn or no to adjourn.
Yes, then I'll vote to adjourn.
Tricia Kerr,
No.
Timothy Lattimore,
No.
Michael Didio,
Yes.
Ryan Foley,
Yes.
Aileen McNabb Coleman.
Yes.
It passed.
Yes, we're
We're
adjourned.
adjourned.
Pleasure doing business with you.
I think the stock options will be good next month.
Okay, we'll see you all next time. Thank you so much for joining in tonight.
Thank you.
That was a lot of
By any
fun.
chance, can anyone hear me?
And now,
Oh, that's nice. Yeah, now that the meeting's over. Great.
Are we off live streaming?
Yeah.
Now, yeah, check yourself.